guys, it's Sarah here. In this video, I'm going to be going over atypical or walking pneumonia. Now, what is pneumonia? Pneumonia is an infection of the lung caused by a pathogen. The pathogen could be a virus, could be bacterial, could be fungus, but it causes an infection in the lung. So now, why is it called atypical pneumonia? The reason why it's called atypical pneumonia is because it's caused by pathogens that are not your typical that cause regular pneumonia. So regular pneumonia, for instance, is caused by Streptococcus pneumoniae, but atypical pneumonia is usually caused by these three pathogens. Number one, Mycoplasma pneumonia, which usually affects people under 40, more milder symptoms. Number two, Chlamydophila pneumonia, and that's usually young children, young adults. And then we have Legionella pneumophilia, and that's typically with older people, smokers, immunocompromised patients, and they have much more severe symptoms. So for this reason, it's called atypical because it's caused by these three pathogens, as opposed to your typical pneumonias caused by Streptococcus pneumoniae, etc. Now, why is it called walking pneumonia? The reason why it's called walking pneumonia is because these patients have more milder symptoms. So in your typical pneumonia, think of someone like sick, call out of work, they have fever, chills, not feeling good, in bed. And with atypical pneumonia, they generally, like I said, not really the Legionella, but the Mycoplasma pneumonia, generally are walking around, which is why it's walking pneumonia. They could go to work, they have a cough, but they go to work, they're doing their day-to-day thing, they just have some symptoms. The most common symptom is a cough, like a dry cough. They also could have flu-like symptoms, fever, chills, cold sweats, sore throat, dry throat, persistent headaches. Some patients have weakness, fatigue, chest pain with breathing, especially when they're coughing, or myalgia, so muscle pain. In terms of spread, how does it spread? It's usually spread by respiratory droplets, so think of your sneezing, coughing, or close contact. In terms of how it's diagnosed, so in non-toxic appearing patients, it's typically like your history and physical, how you diagnose it. It's like a clinical suspicion. That's all that's needed to start empiric treatment. If someone's ill-appearing or uncertain of the diagnosis, you could do a chest x-ray. It's usually the gold standard, and you would see patchy infiltrates, interstitial pattern. It's usually on people who are more hospitalized. You could do, a urine test to check for Legionella, sputum culture to see which specific bacteria. But in your typical non-toxic patient, you would just do a clinical suspicion, and if you're not certain, you would do a chest x-ray. Now, to determine if you're going to hospitalize somebody or not, or if they need outpatient or inpatient medical treatment, you could use the CURB 65 or pneumonia severity index, and those could help to gear you. They're not absolute, always use your clinical judgment, but they could help. In terms of treatment, so the atypical organisms, they lack a cell wall. For instance, Mycoplasma pneumonia doesn't have a cell wall. So your beta-lactams, like think of your penicillins, cephalosporins, they're not going to work because they target the cell wall. And so if you don't have a cell wall, it's not going to work. So for that reason, we typically go to the first line would be macrolides like azithromycin. Though resistance is increasing, but that would, it depends on your area, etc. But that would be your first line treatment against the atypical pneumonia. And that's pretty much it. So if you have any question, put it in the comment section below, and thank you for watching.